Hello everyone, welcome back to our channel Let's Rock with Jagrock Healthcare. So as we all know, epilepsy is a major common neurological disorder and there is many myths, fears and misunderstanding around the epilepsy. So let's break them all with the Dr. Rama Patil. Ma'am, can you introduce yourself?
Hello, everyone. I'm Dr. Rama Patil, consultant neurologist at Suraj Hospital, Navi Mumbai, with special interest in epilepsy.
So let's start with our topic. Ma'am, why did you choose this topic and do female need more attention?
Yes, so epilepsy in females, it's a very important topic because females face very unique gender specific challenges with this disease across their lifespan due to hormonal fluctuations, reproductive health, psychosocial impact, all at different stages of life. There are different challenges associated. So, females need far more attention than males with epilepsy.
And what is the impact of hormones on like in epileptic patient?
Hormones are a very important trigger. Specifically, estrogen increases the risk of seizures, while progesterone is supposed to have a protective effect against seizures. And these hormones keep fluctuating throughout all the phases of life, like from menarche to pregnancy to menopause. So the risk of seizures also fluctuates during all across these life stages.
Okay.
30% of women they suffer epileptic attacks specifically around their menstrual cycles, like just before periods or during ovulation.
Okay.
So that's called catamenial epilepsy. So hormones are really an important trigger for epilepsy.
Okay. And what are the major challenges to manage the epilepsy?
So if we start like in adolescent phase, adolescents the teenage group is supposed to be, at
Yeah.
predisposed to mood changes.
Yes.
They are predisposed to irritation, rebellious mood. Many of the anti-seizure medications are supposed to have behavioral issues as side effect.
Okay.
So we have to be cautious. Like for example, levetiracetam is supposed to increase the mood changes in this age group. So also some other medications like sodium valproate is
Hmm.
supposed to cause aesthetic issues like increased hair growth, increased facial hair growth, also problems like PCOD.
Yeah.
So while choosing medications in adolescent age group becomes very challenging and important.
Okay. So, ma'am, there is term called juvenile myoclonic epilepsy. So, what is that?
So this is a type of epilepsy that generally starts in adolescent, like between the age group of 12 to 14. It's called myoclonic because often patients, even before they get a big blown epileptic attack with jerking of all the body and limbs, they will give you a history that have started dropping things early morning with the jerks, small
Yeah,
jerks
right.
of hands. Like if they are brushing, the brush will fall off from their hand. So, and the major seizures happen, especially if there is a wedding, there's function in the house, and they couldn't sleep in the night, then they get the major seizures. So, that's why this is called juvenile, means seen in this age group of young age group, and myoclonic because of the jerks associated with this epilepsy.
So, ma'am, what are the myths versus reality in female in epilepsy with marriage?
Okay. So, um, the main misconception is about child. Like if the mother is having epilepsy,
Yeah.
people think that it will pass on to the next
Right.
generation. And the other thing is if the patient or if the female is taking medication, that can affect the baby. So these are the
Hmm.
two important misconceptions, which are absolutely not true. If a mother is having epilepsy, there are like 90% of the times it is not going to pass to their child. This is a very important concept that the society needs to understand.
Yeah.
Most of the epilepsies are not inherited. It is
Yes.
like very small percentage. Like around less than 5% of the epilepsies are inherited from parents. So people should be aware of this.
Yeah, right. So, ma'am, should the female should tell their partner if they're epileptic or not before marriage or after? Like,
Yes. So females should definitely disclose about their epilepsy to the partner. First, let's understand why. This is because even if the female is taking medication, it's not that she will never get an epileptic attack. If she misses a medicine or if she sleeps late, there are chances that she will get an epileptic attack.
okay.
So, having it as a surprise after marriage is gonna have more, there are more chances of marital life getting disturbed than having mutual understanding before marriage itself. Now, how to disclose is also an important question.
Right.
So generally, for all the females with epilepsy, it's important that they study, do a job, and become self-dependent.
Yeah.
And when there is a matter of marriage, they should first have rest of the understanding with the partner. Over several meetings, they should understand each other's strengths and weaknesses. And then the epilepsy should be disclosed rather than doing it in the first meeting itself or
Yeah.
as an opening line. And when epilepsy is disclosed, the female should be putting up the positive aspect of it, like how well controlled the seizures are, how safe the medication is, and how high likelihood of having a successful married life and reproductive health is possible despite having medication. This all things should be put up because the partner is not going to have enough knowledge about this, and putting up just the negative side or just saying that I'm taking this medication will negatively impact. So this we can definitely imagine more for tier 1 and tier 2 cities, maybe even for tier 3 cities to some extent. May not be possible for villages where the boy and girl never meet each
Hmm.
other and
Right.
dadajis and taus are taking decisions about marriage.
Yeah.
So there some other different approach, like more educational methods, epilepsy clinics where things are uh, educated, are needed.
So after that, they also plan the pregnancy. So there will be the challenges to handle that also. And what will be the challenges during the pregnancy, and what precaution should they take?
So um, pregnancy is again a state where there are gonna be a lot of hormonal fluctuations,
Right.
and hence there is increased risk of seizure. So the pregnant female has to take the medications regularly, and the dosages need to be modified many of the times. The most important thing I'll say is that a pregnant female with epilepsy, she should consult a doctor well in advance,
Right.
specifically a neurologist. It's basically a multidisciplinary approach, like a gynecologist is involved, a neurologist is involved, and there is better communication between all these specialities. So when a doctor gets chance to uh, talk to the patient before they plan pregnancy, there are certain medications which could harm the baby. They could
Okay.
be, switched to safer medications, and also some supplements like folic acid,
Hmm.
which prevent certain very dangerous side effects or anomalies in the baby, like neural tube defects. They
Okay.
can be provided to the female even before conception if they consult the doctor well in
Hmm.
advance.
Hmm. Hmm.
So, planned pregnancy is very important in females with epilepsy.
Okay.
And apart from that, definitely we change to the medications which are safer, which are less harmful to the baby. And we advise these females to undergo routine
Hmm.
antenatal scanning, like anomaly scan 1, 2. There's a crucial period between 18 to 20 weeks
Okay.
uh, where they can get a sonography done, and even minor defects in the baby could be detected
Hmm.
apart from certain blood tests like quadruple test. And there's some other procedures like chorioamniocentesis. All this can help to detect even minor abnormalities in the baby, and necessary actions could be taken off. So, these are the different challenges, but it's very important to understand that with proper treatment and proper care, there are more than 90% chances of having a successful normal delivery and a
Okay.
healthy baby.
Okay.
So,
So, is
yes.
there necessity of C-section in females with epilepsy?
Absolutely not. So
Okay.
females with epilepsy can have a very well, they can have a normal vaginal delivery. Only the cesarean section will be for obstetric indications, obstetric complications, or baby related thing, but not the epilepsy per se is not the, it.
Restricted.
This will
Yeah.
not
Hmm.
increase the chances of cesarean section.
Okay. So, ma'am, is breastfeeding safe in the that period?
Absolutely, very important question. So most of the medications which are used these days,
Hmm.
they pass into the breast milk in a very small amount. So that is not found to be harmful to the baby. It's and the benefits of breastfeeding are far more than whatever little side effects which are very rarely seen with these anti-seizure medications. It's very, very important that during breastfeeding, the mother continues the medicines,
Hmm.
and breastfeeding is highly encouraged uh, from baby point of view.
Okay. So, talking about the next stage, during menopause, how one should handle it, and what is the necessary precautions to take?
So, menopause again is a state of hormonal roller coaster,
Yeah.
and uh, it becomes important. Some females are taking certain hormone replacement therapies. So this age group is again at risk of increased frequency of seizures. So we need
Hmm.
to adjust the medications, and the medications interact with hormonal replacement therapy,
Okay.
and there could be reduced effectiveness. So the female has to discuss that if she is taking any of such treatments with her neurologist, so that the dosages or the medicine type could be adjusted. Apart from that, in this age group, the bone density, these age group, we often see osteoporosis,
Yeah.
and that the risk of osteoporosis is increased with some anti-seizure medications
Hmm.
like phenytoin and carbamazepine. So, supplementing vitamin D, calcium, advising them about diet, and some exercises like weight bearing exercises, which help to prevent osteoporosis. Changing the anti seizure medications to the ones which we don't predispose to osteoporosis, and getting regular bone scans done will help to reduce the risk of these problems. And this is can be done by regular follow up with your neurologist.
Okay. So, ma'am, do anti-seizure medication react or act with contraceptives?
Yes. So many of the anti-seizure medications, they interact with oral contraceptive pills,
Hmm.
and that's why and they reduce their effectiveness. So it's advisable not to use oral contraceptive pills. Or if someone is taking, they should take it in a higher dosage.
Okay.
But better is to use other methods of contraception like barrier devices or intrauterine devices. But it's important to use contraception because unplanned pregnancies, again, with epilepsy, will be more of a risk than a planned pregnancy.
So, ma'am, lastly, what will be your message to all the females with epilepsy?
So, I would like to tell all females with epilepsy that having been diagnosed with epilepsy doesn't end your life. It doesn't define you. It's just part of your story. You can still study, do a job, have successful career, including successful married life. So, don't let this disease limit you in any way. Thank you.
Thank you so much, ma'am, for your valuable insights on epilepsy. Thank you everyone for watching this video. I hope you find this video useful and helpful. I truly appreciate your time and patience. Don't forget to like, share, subscribe. Until then, stay informed, stay healthy.